Good morning, afternoon, or evening. The topic I have chosen to speak about today is alcohol and pregnancy. Therefore, the population group in which this presentation will focus on are women of all ages. We'll be focusing on women of all ages as no matter what age, alcohol and pregnancy can arise. The Australian Department of Health makes it very clear that there is no safe level of alcohol consumption when it comes to pregnancy. This is due to the fact that if you, as a woman, are consuming alcohol whilst pregnant, then so is your baby, therefore affecting both the mother's and baby's blood alcohol content, otherwise known as BAC. A baby is most at risk when alcohol is consumed at a high level consistently throughout pregnancy. Although even the slightest consumption of alcohol throughout the first trimester of pregnancy specifically can indeed affect the baby long term. Every pregnancy is different, just as every individual is different. Therefore, much the same, the way alcohol can affect a woman's pregnancy is also different. These effects can include, but are certainly not limited to, miscarriage, premature birth, birth defects, FASD, otherwise known as fetal alcohol spectrum disorder, and in some extreme cases, stillbirths. Not only does consuming alcohol during pregnancy affect the baby, but can lead to higher chances of experiencing increased vomiting, nausea, high blood pressure, dehydration, and nutritional deficiency for the mother, as well as developing gestational diabetes. A study that consisted of 232 pregnant women showed that age was a major predictor of alcohol consumption. It showed that women in the 25 to 29-year-old category and 30 years and over were significantly more likely to consume and abuse alcohol in comparison to younger women. In addition to this, overall health was also seen as a predictor of alcohol consumption during pregnancy. This study suggested that women of a good overall health were less likely to consume alcohol during pregnancy in comparison to those women that showed poor overall health, in saying that this could only be applied to women of a higher income. In addition, physical abuse was also seen as a major predictor of alcohol consumption during pregnancy. Those women that experienced any type of physical abuse within the last 12 months were more likely to drink alcohol during pregnancy. As well as this, it is no surprise that those that also suffered from sexual abuse had a great spike in their levels of alcohol consumption. Furthermore, marital status was seen as a strong predictor of alcohol consumption. Women who were single were more likely to consume alcohol during pregnancy, in saying that those women that were single extremely lacked support and a stable environment for themselves and their baby in comparison to women who were married. Last but not least, the study further demonstrated that women who suffer from psychiatric illnesses as well as drug addiction had the highest rate of alcohol consumption in comparison to those who did not suffer from any mental illnesses or drug addiction. Perhaps the simple answer of most of us to these problems would be to go seek help, although women are often faced with a number of barriers when it comes to accessing help. One of the biggest barriers was fear of punitive policies and the justice system. Many women feared that they would get in trouble for their actions, therefore failed to access things such as prenatal care or skipping appointments with medical professionals. Although those women who made the choice to attend their appointment often concealed their alcohol due to fear. On the contrary, there were some women who made the choice to be honest about their alcohol consumption with a medical professional, but then regretted sharing this information as they were dissatisfied with the treatment and judgment they received, therefore making them less likely to be honest with future medical practitioners. Another massive barrier was social isolation. Many women isolate themselves from those close to them as they fear they will detect the alcohol consumption whilst pregnant. In some cases, women even denied their pregnancy in order to continue drinking without judgment by those around them. A second reason as to why women would self-isolate or deny their pregnancy was due to the fear of being reported to social services and losing their baby once it was born. There are a number of ways in which we can tackle these issues at a number of different levels. One way is social marketing. Social marketing is already a strategy used by developing campaigns in which aims to raise awareness on the consequences of drinking whilst pregnant. Although this is a good overall strategy that has a national target audience, the government should look at tailoring some of these campaigns to both high-risk groups as well as culturally diverse groups of women. Another way in which the Australian government could reduce alcohol consumption amongst pregnant women is place big warning labels on all alcohol products, as well as placing warning signs at different venues such as clubs, pubs, and bars. This is important as these are all places women are most likely to drink. These warning labels and signs could act as a reminder for women that what they are doing is wrong and harmful for their baby. Lastly, another prevention strategy that could be used and has been spoken about is alcohol screening of all pregnant women, despite their age, ethnicity, socioeconomic status, etc., in order to detect it early and be able to give them help in a non-judgmental way and refer them to services such as alcohol services, which are experts in the field as opposed to just medical professionals. In summary, alcohol consumption can have a long-term negative effect when it comes to your baby. High-risk groups include women that are 25 years and over, those that have experienced physical or sexual abuse, as well as those suffering from psychiatric illnesses. Therefore, in order to prevent dishonesty with medical professionals and self-isolation, we can turn to social marketing towards these high-risk groups, as well as placing warning labels and signs in order to prevent alcohol consumption. Although in some instances where it cannot be prevented with this, we must use alcohol screening in order to detect alcohol consumption early and give these women their professional help they need in a judgment-free environment. Providing a judgment-free environment will also allow for women to perhaps open up and be honest in the future. Thank you.